Hello, how are you? Thank you guys so much for joining me. I am Chrissy Chin. I am a registered nurse and here to talk about modern healthcare and why we need options. This is a big topic and I'm gonna go at it from a nurse's perspective. So hopefully you follow along with me. I want to talk about the oil of the day first before we get started, which is humility. I put a little of this on, and that is because I just feel so humbled to be here to talk to you about this topic today. I'm grateful that you're willing to listen. This is also a great one to use if are already an oiler and you have this one, get this one out and apply it, because this one is really great to just help you be a little bit more open to the words that you're going to hear and sort of take it in so you can think it over and do with it what you want. So let's get started, because we have a lot to talk about here about modern healthcare and why we need options, right? Okay, so, a little bit of my history. I grew up in a great family. My father was a pharmacist, still is. And so I grew up with the idea of just, medications do us well and they help us feel better and they make us well when we're sick and things like that. And then I went to college and I took anatomy and I took physiology, and I absolutely loved those classes. They were beyond my favorite classes. I was getting straight A's in those because I just found the human body so fascinating, and just how every little system works together to create this one system, or your body. And I just found it incredibly fascinating. And so I just thought, you know what, I'm going to be a nurse and I'm going to, work with people on their bodies and I'm going to help people feel better. And so that was what led me to becoming a nurse. And when I was done with school, I worked in the pediatric ICU. I worked in the pediatric acute care, and I did the neonatal intensive care unit as well. And I did some clinical work and things like that. So that is sort of where I'm coming from, is just this pediatric nursing background, okay? So I totally, working in the pediatric ICU, I know there is a time and a place for Western medicine, and I am so thankful for the doctors and the nurses out there who help kids with broken bones and emergency surgery and pain medications when you just think you're going to die because it's so bad. And I think that it's great. I think that it's all great, but I think that it's way overused in our culture, and we're going to talk about that, okay? So I think when nurses and doctors do what they're trained to do, people often become less well. And that's not intended. When we help people, it's not intended to make them less well, but that's what we're trained to do, right? So it's not the doctor's, it's not the nurse's fault. But when you go see a doctor, they're probably not going to get in depth with you about, your diet and your work habits and your stress levels and your lifestyle, unless they are specifically, you're seeing a specialized person for that. But your normal doctor is just not going to do that, right? You're going to come into the office, you're going to tell them what is going on, what you're feeling, what you don't like, and they're going to get out their prescription pad and they're going to write you a script for some pills, okay, for a prescription. And in their defense, that's what people want. People want a quick fix. They feel crappy and they want to feel better fast, and prescription medications can do that, right? All right. So we know that feeling sick and feeling crappy, it just really sucks, right? Nobody wants to feel that way, and they want to get back to wellness as quick as possible. And sometimes managing those symptoms with pills can help us feel 100 times better quickly. And so we're grateful for that. And let's be honest, that making lifestyle changes is really hard work. Okay, and sometimes it takes a little longer than we have the patience for. But what happens when we don't get to the root cause And we just cover up those symptoms that we told the doctor. And they're like, oh yeah, I can definitely take care of those itchy eyes. Let me write you a little thing. But what happens when we don't get to the root cause is that we are just going to come back in for the same thing. It's going to happen again. Okay, and that's what I noticed working in acute care. I would either see the same kids, it's like a revolving door. They would go home and then they would come back, and then they would go home and then they would come back. And some of it was definitely due to genetics and, prior conditions, but a lot of it I noticed could be prevented. Did you know that according to the American Cancer Society, 95% of cancer is environmental? Only 5% is genetic. So that means that we can stop a lot of cancer by paying attention to what we put inside our body, to what we rub on our body, and what we're just exposed to in our environment. Now, total side note that we're learning that genes can actually be turned on and off, which is a whole nother topic, which is really cool. So we can actually probably prevent a lot of this stuff. But that's like a whole nother discussion, right? Okay. So let's get back on track. Being exposed to, all of the illness when I was as a nurse, that's when I really developed my passion for preventative health. And if you watched my story in the beginning, then you will know that some healthcare challenges that I had growing up, also led me to some of these holistic ways. My sister sort of led the path as the guinea pig when she was first having some health challenges, and she found a natural way to figure out what was going on and to treat that. And so I was able to kind of avoid some of that modern med and poking and prodding and just go right to that holistic approach. And as long as I stuck to that lifestyle, I felt great. But it was really hard. It's so hard. Changing your diet is hard, you guys. And I'm not perfect. It's a lifelong journey, and I have, go in and out of following that diet. And right now I'm trying to get back in, so I'm gonna be totally honest with you. It's really freaking hard. But I love knowing that if I were to do what I know I need to do in my lifestyle, with diet and exercise and all that stuff, that I can feel really, really amazing. And I can do it in a healthy way that's not going to long-term affect my liver and my kidneys and things like that. All right, so during that little health journey of my own, I became very aware of diet and exercise and learning about food as medicine. Like, who would have thought? Food is medicine. Love it. Okay, what you put in your body absolutely affects how you feel. At least it did for me, and I think it does for a lot of people. The quality of the food, the mood that you're in when you eat your food. Did you know that if you're stressed out when you eat, that you do not absorb half of the nutrients that you would if you were normally eating peacefully and mindfully? That is crazy to me. Crazy. I had an entire semester of nutrition in nursing school. An entire semester, one class. But guess how much doctors have? Guess how much nutrition they have in their 12 to 14 years of training? They have 4 hours. Yes. One afternoon in all of those years of training on nutrition. That is totally mind-blowing to me, okay? What we eat is absolutely foundational to our health, so why aren't they getting the training on it? If that is a direct correlation to how our health pans out, why are they only getting 4 hours? But if you actually look back at the history, and I'm not going to get too much into this, but medical schools at one point did have a holistic natural approach, and then they were bought and funded by drug companies. And so it's no surprise that they made the shift from looking at natural ways to help heal and learning all about drugs that we can use to help us feel better, okay? So we're really good at sick care. We are not that great at health care. But if we can teach people the importance of food and nutrition and a healthy lifestyle, they can improve their life and they can live healthier. Okay, so that's part of my passion and my mission in life, is just to get the word out there, get the knowledge out there so that you can take that knowledge in and you can decide what you want to do for yourself and your family, okay? Let's talk a little bit about numbers and a study for a second. So a study in 2015 reported that 250,000 people die each year from iatrogenic causes. Okay, I'm going to read you the definition of that. Let me find it. It's up here somewhere. Iatrogenesis is known as the inadvertent and preventable induction of disease or complications by the medical treatment or procedures of a physician or surgeon. Okay, so these are things, medication errors, doctor and nursing errors, even properly used prescription medications. 250,000 people die every single year. And I think that there's newer studies where those numbers are actually up. 100,000 alone die from proper use of prescription medications. Proper use. Okay, I'm going to read you something else here. Over a decade, the scientists predict that iatrogenic deaths will total about 7.8 million, more than all the casualties from all the wars fought by the U.S. throughout its entire history. A death rate equivalent to that caused by 6 jumbo jets falling out of the sky every single day. And then they looked at, a period of time, and I'm happy to, pass the study along, but a period of time, and the study authors, using the most conservative statistics they could find, broke down iatrogenic deaths over 10 years. And I'm just going to read the top number. Adverse drug reactions, 1.06 million deaths over that 10 years of drug reactions. So again, that goes back to the proper use of prescription medications. They're being used properly, but then there's this interaction, and we're all different and we all respond differently, and it caused death. Death is so permanent, you guys. All right, so some people may say, yeah, but that's the price that we pay, doing healthcare and, taking prescriptions. But I'm here to tell you that it doesn't have to be. Doctors take a Hippocratic oath to do no harm, and they are not intending to do harm when they care for their patients. Trust me. I have tons of doctors and nurse friends, and they have absolutely the biggest hearts. And they absolutely want to help people. They want to help you. They spend so much time with their patients. They sometimes spend 24 hours straight with no sleep, giving so much emotion to their patients and their families. And it's taxing. It's exhausting. So I love my doctors and my nurses, but I do believe from some of those numbers that I shared, like the fact that doctors only get 4 hours of nutritional training, that they're really set up to manage sick people and to treat with prescription medications, because that is what they are taught to do all throughout school, is prescribe medications. And again, we have some of the best doctors and hospitals in the world, and I'm so grateful for them, in times of emergencies and life-threatening infections or arrhythmias. But the fact that most medications don't really get to the root cause is what's causing us to be sick, and be on these medications long term, like blood pressure meds. Something is causing you to have high blood pressure. Now, it can be a lot of different things, right? But some of them are due to the things that we eat. So if you focus on lifestyle and healthy eating, and make healthy choices, you can lower your blood pressure by natural means. If you don't make those changes, you will continue to have high blood pressure, and you will continue to have to use those medications till the end of time. Okay? And that's going to cause damage on things like your liver if you're always taking those medications. And I know what you're thinking, well, what about antibiotics? You take antibiotics short term, so that should be fine, right? You're not taking antibiotics all day, every day till the end of time. You take them to kill that bacteria so that you can get well and then you feel good. But let's think about how you get sick in the first place, okay? We encounter bugs and germs all the time, and our immune system is there to take care of it, to find those little germs and bugs and to kill them so that we don't get sick. But when you're not treating your body well and you are consuming large amounts of sugar and you're constantly stressed from work or life or whatever, and you're not taking in the proper nutrition, your immune system is less effective. Okay? This is proven science. So it's out there. Go look it up. Go research it. You don't have the ability to fight off those bugs and stay healthy if you're just, your body is just stressed all the time and you're eating all this crap, okay? So when you get sick and you go to the doctor, they prescribe you this antibiotic, and what do the antibiotics do for you? Yes, they may be killing that bacteria that's causing you to not feel good, but it's also killing all the bacteria in your body, and we have good bacteria in our body that we need, okay? And don't even get me started on the fact that you may have a viral infection, and antibiotics don't do anything for viruses. So you could be taking this antibiotic, killing all of your good bacteria. Sorry, I had a brain spasm there. And so it's not, you're like just taking it and you're killing all the good stuff, and it's not even getting to what's making you feel sick. So, all right, so let's take a look at what taking antibiotics does for your health. So it's killing all of your gut flora. So in your gut, you have good bacteria, okay? You need good bacteria in your gut for a healthy immune system. And for a ton more, you need it for healthy emotions. I mean, so many things, okay? About 80% of your immune system lives in your gut. So if you were to wipe out all the good bacteria, because you're trying to wipe out the bad bacteria, without replacing it with probiotics and eating fermented foods, which a lot of us don't do. Who here eats sauerkraut? Not me. Then you basically just wiped out your good bacteria. That helps you fight off infections. It helps you digest and absorb your nutrients. It helps you send signals to your brain. Hello, unstable emotions, maybe because we all have like poor gut health. Basically gut health is the number one thing to focus on because it does so much good for our body when it's functioning properly. And your body is designed to take care of you. So do your research. If you get sick and you go to the doctor and they give you an antibiotic, they write you a prescription for antibiotic, do some research. Take that prescription home. Look at your options. By all means, if your doctor thinks that you have a life-threatening infection, take the antibiotics. But please be your own health advocate and do some research. And then eat those fermented foods and do all those things to get your good gut health back up, okay? Taking antibiotics anytime you get sick is also giving those bugs a chance to adapt and to evolve and to become resistant, which is why we now have antibiotic-resistant bugs. But if you take care of yourself and you give yourself the proper nutrition to do the things you need to do to keep the stress down and to get a hold of your emotions, you will set yourself up and your kids for success. And you will be so much healthier and you won't become dependent on the system. It's like the clouds just parted and the angels sang down. Okay, so let's first try some healthy things. Okay. The second class of drugs that I want to talk about and that I think represents this is the antidepressants and the anti-anxiety medications. So 25 to 30% of women are using these drugs. That is 1/3 of our women out there. I don't know if the incidence has gone up in the last handful of years. I'm not sure. I do not know. But I do know that life is stressful. And I know that as soon as you have children, it jumps up like tenfold or 100 times fold, you guys. It is hard. And I totally understand feeling desperate and helpless and going to the doctor, and getting your hands on your medication. And I'm not against getting help from professionals, not at all. Please don't, misunderstand me. Just like everything else, there is a time and there is a place, and I know that at times some of these drugs can be life-saving. So please, there is no judgment here, okay? Let's talk about normal moods. okay? Normal moods are cyclical. They go up and they go down. And you have happy times and you have sad times. And when you take these drugs, these antidepressants and these anti-anxiety meds, you flatline. Here are your emotions. You don't express the lows, which took you into the doctor in the first place, so that's great. But you don't get to experience the ups and the joys in your life because the meds are keeping you here. You're just here. You're just going day by day, living life. So another thing is that you have serotonin receptors all over your body, not just in your brain. And serotonin is like the happy, feel good thing, okay, that's in your body. And so these medications are targeting these serotonin receptors. And they're actually primarily focused or found in your gut, in your GI tract. Again, gut health is the main thing you need to focus on. So these drugs are literally acting on every single system in your body. Okay, so you are basically blocking your emotions. Again, this can be helpful for a short period of time, but so often when we go on these medications, there's never an end point or an out, right? You're on this med, you're taking this med. Okay, so when you get past the situation that put you into that state, there's no out strategy. And then you're just dependent on those drugs. And some people are on those drugs for 10, 15 years. That's a lot of years to just be walking around with blocked and suppressed emotions. It's not good for our society to have 1/3 of our women having completely blocked emotions. And another thing that it does is decrease your sex drive and your libido, which isn't good for our marriages. So I look at these side effects and I wonder, is it worth it? And I know for some people, yes, it's absolutely worth it to take these drugs and to help them, get through this dark time and get them out of this dark time, because it would be really bad if they didn't. And sometimes it's more than just getting over a hump. I totally hear that too. I understand that. And I know that if what you're feeling is situational or deeper than that, like you know if it's situational or if it's deeper than that. Okay? As women, we carry so many burdens. Burdens of our children, burdens of our parents, burdens of our spouses, our friends. And sometimes that weight is heavy and we do need help. But for most of us, I don't think this class of drugs is the answer. Okay? And it is part of my mission to help people find some other options, help them find some coping strategies. Because if it's just this little situational piece, let's find some things that we can use to help us, get out of this and move through this in a healthy way so that we can then get back to our normal emotions, okay? Because it's okay to feel sad. Sometimes we need that. This is why we have the cyclical emotions. We need to have these sad moments so that we can know what the joys feel like, okay? We need to have those. But there are so many things you can do to help you learn to cope with these situations. Nutrition is one of those things. Never underestimate the power of proper nutrition. Are you seeing a theme here? We're all talking about nutrition. It's one of the answers to everything. So focus on gut health to help regulate emotions so you can have an out strategy at some point, or just avoid, turning to the drugs altogether, because you are able to manage your emotions better, okay? So we can live a vibrant life, so we can get our little spunky lives back and just feel those happy moments in our lives. And again, I'm not telling you if you're on medications, I'm not telling you to just go get off your medications and let's do these things. Let's just focus on nutrition. You need to talk to your doctor. You need to follow your doctor. But if you've been on these medications for a long time and maybe it was just situational when you started, start talking to your doctor. Do we have an out strategy for this? Or am I going to be on this forever? You don't have to be. Okay. So we're also going to do an entire class on essential oils and emotions. And you're going to be amazed by all the things that you will learn about with moods and emotions and essential oils. Okay. There's nothing like being a mama without our full spectrum of emotions. So we want that. And just because you're not a doctor does not mean that you are incapable of doing research. Don't just blindly take a handful of medications that your doctor gives you. Look up the dangers of your situation and look up the dangers of those drugs that you're prescribed and ways to, naturally heal. You don't have to be a doctor or a pharmacist or a nutritionist to research your situation and to be able to make informed decisions about your health. Don't just believe everything that you hear, and don't believe everything that I say either. Go do your research. Don't let anyone belittle you for doing research either. You have the world at your fingertips, and you can find a lot of answers. Okay, let's go back to the drugs and why and how they make drugs. Okay, drug companies make drugs to make money. Let's be honest, and to create a lifelong customer, just like all other companies. If they were to make a magic drug that really cured you and got to the root cause, then you would be a one-time customer, and that would be bad business for them, right? So typically, to make a drug, they find a molecule out in nature, and then they isolate it, they take it into a lab, and then they package it with all these other molecules to get exactly what they want to do so that they can put a patent on it to make money. Because you can't put a patent on a natural molecule. You can't put a patent on broccoli or corn, which is why GMO was really created, okay? You can patent GMO food. Okay, that's a whole nother topic for discussion, which we won't get into. But the point is that now they have turned this natural molecule into something that is unnatural for your body. And your body has a hard time recognizing it and processing it. And this is why we have side effects. This is why the medication that will help your allergies may also have side effects of nausea, vomiting, diarrhea, dizziness, lethargy, may even cause death. Remember, 100,000 people die from prescription drugs every year just taking them as prescribed. But you don't want to have those itchy eyes. No. As I itch my eye. Back in the day before our culture of medications and pharmacies on every single corner, families used herbs and tinctures, and they made bone broth to get better. They weren't using toxic chemicals all day, every day in their skincare and house cleaners either. We are in a culture to make things bigger and work better and faster and last longer. So you better believe that your face moisturizer that you buy today from X company is not the same as what your grandmother bought. That way, that's backwards to you, right? They discover X filler, that makes the skin appear softer and the customer's happy. But then after 5, 15, 20 years of using that product on your body starts to shut down because what you were putting on your body and it was absorbing into your skin was synthetic. And it was wreaking havoc on your system the entire time and you had no idea. I don't think much about environmental stuff. I didn't really think much about environmental stuff until I had my son and was introduced to Young Living, really. That's when I really started researching environmental toxins and learning about all the junk that's in everyday products like lotions and shampoos and hand sanitizers and antibacterial soaps and laundry detergents and cleaners, and how detrimental some of these chemicals are to our health and our nervous system and our reproductive system, causing infertility, and that they can cause cancer. And the babies that you grow in your belly are affected in utero by the things that you're using every day on your body. And they can get away with it because sometimes we don't really realize that our exhaustion, our mood swings, our joint pain, our digestive issues are all being caused by chemicals that we're using every single day. And people my age have now been living their entire life using these products with toxic chemicals every single day, and now we're sicker because of it. Okay? So we have talked a lot about how proper food and nutrition is vital to your health, and that it is hard to make, those healthy choices, to choose that salad over that mac and cheese. But how easy is it to put that non-toxic cleaner in your grocery cart or in your online cart? Or that toxic-free shampoo that you use every single day. And then all you have to do is just reach for the non-toxic stuff versus the toxic stuff. Like that's easy. That's way easier than like having the self-control to like choose the really healthy, yummy salad. Okay? Just choose the non-toxic shampoo over the toxic stuff. Okay? Take responsibility. This is one of the best parts about Young Living, that they're a company that will not, absolutely will not put anything in a product that is even questionable for your health. Trust me, I have spent hours looking up ingredients on their products to help educate all of our members. And every time I'm just floored by the fact that there's nothing bad in there. So much of it is plant-based, like the Thieves Cleaner, which we love, is plant-based. It's so, so safe. I don't have time to be in the store plugging everything into the Think Dirty app and finding the rating, or I don't anymore. Like I used to do that stuff. I don't have time anymore to do that. Or to go onto 15 different sites and order, a few products from here and a few products from there. I don't have time to do that. I have done my research. I know and trust that Young Living is safe in every way. So boom, it's easy. I just order all of my stuff through Young Living. All of my home products, all of my self-care products, my oils, of course. Like I just order them all and then they get shipped to my doorstep and it's super convenient. And trust me, I know that sometimes, we need to do, excuse me, I know that sometimes that it's really hard to make that first step in actually doing it. But essential oils are the way to bridge that gap. It's the easiest way to take that first step. And they can help us find the motivation to really take that first step. Yes, there is an oil called Motivation, and I use it often to help me get done the things I need to do. Okay? You can learn how to use these oils on a regular basis to support your body systems and your emotions so that they can function how they were designed. All working together, all of your systems working together, so you can live a full and vibrant life with energy and joy. How awesome does that sound? It sounds good, you guys. Take a look at the price alone. Look at how much we are spending on healthcare. We spend exponentially more on healthcare than anyone in the world. And we do not have A+ health to show for it. We are one of the sickest countries. American healthcare is the second largest growing business in the world. Yes, the second largest growing business in the world, American healthcare. And we cannot sustain this level of expenditure, especially when it isn't getting us healthier. So just rethink this whole health thing. Just take a second, take a step back, digest it, and just rethink it, okay? This is the only body that you have. So don't just turn it over to someone else and put it in their hands, okay? Be a good role model for your children and teach them by being an example and taking care of your body. It is a blessing and it is a beautiful thing. And if you start early with your kids, you can create some amazing healthy habits to change the paradigm. We're already seeing it. We're seeing a huge shift in people that are waking up, that are taking control of their health, and that are choosing to spend their money on experiences that brighten their mind and make them feel happy. And they are spending money on health and wellness because there is nothing better than feeling well. Just remember the last time that you were sick. You probably said, gosh, I would do anything to feel better right now. We're feeling the beginning of this huge shift in health and wellness. So come be a part of it. It feels good. It does. So I remember when I started sharing more about oils with my friends and remembering my girlfriend's husband calling me the snake oil saleswoman, which is really funny because he is the first husband on board and uses oils and really likes them. So he may have just been giving me a hard time. But I was just sharing, like, these are amazing. He's like, yeah, your snake, your voodoo oils. Okay, some people thought I was crazy. Using these little bottles of oils with no scientific data. Oh, let me tell you, there's a lot of science out there about these oils, so go do some research for you science people that need that research. Go look it up. Go do your research, okay, before you make that judgment. All right? There's a lot of research about them and how they work. And funny enough, the word pharmacy, which we have a pharmacy on every single corner in our culture, actually comes from the root word pharmakeia, which means, drum roll please, witchcraft or sorcery. How ironic is that? I just think it's really funny. So I thought I would mention it. All right, so let's get out of those preconceived ideas and thoughts out of your head and just go through this 10 days with an open mind and an open heart, and just be able to hear what is being presented to you and then use it in a way that will better your life and your family's life. I've had so many friends tell me that introducing them to essential oils has helped them tremendously. You know, it's helped empower them to take control of their life and feel amazing. And I personally feel insanely blessed and grateful and humble that I was able to share all of this stuff with them. Okay, that's all I'm doing. Like, I just found this and I just am like, I want everyone to know. And then you can be an adult and you can make the decision on whether or not you want to do it or not. All right. So with all of that, let's give one of these or do some giveaways. Okay, so we're going to do a giveaway. We're going to do it in the next post. So I will post that over there. You can hop over there and enter to win something really, really amazing. Thank you guys so much for listening to Modern Healthcare and Why We Need Options. And I hope that you enjoy the rest of the days and all of the content that we have for you that our hosts worked so hard to put together. Yeah, that's it. You guys have an amazing day and we'll chat soon.